doctors who seem to be devoting their lives and giving everything they have and facilitating upliftment of communities way beyond clinical care seem to be victimized. And that's where I kind of think, well, there's something really wrong, that's going on.
The state of rural healthcare in South Africa is deplorable. A beacon of light amid the darkness has been the Zithulele District Hospital in the Eastern Cape, but it is facing political turmoil. Joining me to discuss is Chris Bateman. He was news editor of Izindaba, the news section of the SA Medical Journal from 2000 to 2016, and spent the prior decade covering provincial and national politics for the Cape Times after graduating from covering the Cape Flats townships during the struggle years. Chris, thanks very much for being with us. What's going on at this hospital in the Eastern Cape? And as someone who studied at Rhodes, I was lucky to be in the Eastern Cape for a few years, so this is close to my heart as well.
Chris, I haven't got the to-date update. There's an inquiry into the perturbations and the antagonism, whose findings are about 3 weeks overdue, but I'm told by people at the hospital that it's due any day now. How equivocal that'll be, we don't know. It'll reveal a lot about the state of politics. But basically what went wrong is, as I've discovered in my 20 years or so of covering rural healthcare, which is a particular love of mine, you get, one can argue the cadre deployment point. I mean, it's a hot political potato, but you get what I've seen, these are the facts, is this CEOs are appointed, generally a junior nurse or a staff nurse or just a nursing sister. And they're appointed at short notice in charge of clinicians at district hospitals, which are generally, 125 beds, 250 beds, they're big hospitals. They serve drainage areas of hundreds of thousands of people in deep rural areas. And it's an intrinsic problem because the clinicians, the longer they've been there, the more they're going to resist a junior person being above them. And one can argue the founder syndrome, Zithulele, it may even apply, because they've been there, the two doctor-married couples from UCT who've been there like 17 and 15 years respectively. So one could say, look, they didn't like the disruption of a new CEO, but there's a wider context. The wider context is that an 890 million rand upgrade to this hospital, which has won many awards for its excellence, its holistic, multidisciplinary care. They've set up all sorts of NGOs, nutrition, HIV/AIDS, and the UCO came. So this building was due to happen. In fact, they've started the foundations right next door to the hospital. Suddenly, I'm told, reportedly, the local headman and the chief got the ear of the CEO when she was appointed in October last year, and they said, look, we've got these doctors are going to be a problem. There's this building coming up. We need her out. This is not anecdotal, I can't prove it, but the long and the short is that the CEO immediately got into a clash with the chief clinical officer, and he didn't take kindly to her discharging patients downstream to the referral facilities and clinics, some of them against his clinician's advice, which really got him riled up. And so it eventually turned toxic. And what happened is the community, who had come to know and love this doctor cohort of some 14 people, especially the founder members, call them the founder members who went there 17 years ago, got riled up and actually started protesting outside the hospital on a weekly basis in support, mind you, which is quite opposite to what happens a lot in rural areas where the unions tend to support the administration, in support of the doctors. And so last Thursday, it would seem she called in the police, and the police arrived from the Entitah, I believe, public order policing unit in a hippo and 2 support vehicles, about 15 policemen and women, I think. And they fired tear gas and rubber bullets and injured 7 of the protesters, whom the doctors say were protesting peacefully. They weren't blocking a road, as the police alleged, and so forth. And from there on, it just degenerated. And the CEO was then seen off the premises a few hours later. Protest started at 7:50 in the morning. Police came just before lunchtime. Violence happened around about midday. And the CEO, who said she was in office when it happened, I spoke to her, was escorted off the premises from her house by the hippo and policemen walking with weapons ahead of her. And there wasn't really any threat to her, although people were shouting at the car that she was in and so forth. But that's the picture.
Well, Chris, in your article on Biz News, to which we'll link to in the comment section below, you say that adherence to the policies of the ANC's tripartite alliance is slowly destroying rural healthcare delivery in South Africa, things such as cater deployment and government backing of unions. I think a lot of us analysts, we enjoy talking about things in the abstract and the theory. So how do those things such as cater deployment, for example, and adherence to ideology, how does that concretely shake down on the ground in terms of the running of a hospital?
Well, as I've illustrated, very often you have a seniority problem. You know, people who don't have the experience and perhaps the respect of the people under them are appointed. But, you know, I spoke to somebody central in the province, and I've spoken to previous DGs and built relationships with them, director generals. And the MEC actually appoints, you know, is finally responsible for who gets deployed. But the actual technical process is carried out by the admin and the HR, the human resources staff. So one can debate that point endlessly about who gets appointed. But the trend that I've seen is that, I mean, I can quote many stories. The Fort England Hospital with Dr. Roger Walsh, who was appointed there in, I think, 2012. And in 2016, he started sorting out some of the overtime hassles, and they were working 5-hour week. They were working 4-day weeks. So he made them 5-day weeks. The union went on strike. They didn't like it. And they eventually ran riot, 7 or 8 of them running through the wards. It is a mental hospital, a psychiatric hospital, maybe more correct. And blowing whistles and hitting sticks on the ward doors and on tables, blocking the incoming food, stopping the clinicals, the kitchen staff from coming in. The doctors, the psychologists, and some of the cleaning staff actually helped to source food from fast food to keep the hospital going. Basically, they brought the hospital to a standstill. MEC steps in and says, listen, the union doesn't want you there. You are the cause of the trouble. You know, what you're doing is causing trouble. And they suspended him for 6 months on full pay. And he won a court case in which the judge was excoriating about the MEC's behavior. There's a Dr. Kobus Kutsia. This is the 2012-2016 period. He was kicked out of Livingston Hospital. He was a CEO. There was a Dr. Mkanduli or Mkanguli at Dorangenza in Kabeja, PE as well, kicked out. She was the one who was famously reported as having caught nurses sleeping on night duty. And that conflagration was the final straw for them. So it seems to me, without, you know, any political agenda or anything, it's the facts of the things that keep hitting my radar seem to show that there's an unhealthy alliance between the politicians and the unions, in which doctors end up drawing the short straw. And, you know, it's not like they've had an easy ride. I mean, during the Manto Shabalala Mbeki days, I mean, Peggy Ngonyeni was MEC in KwaZulu-Natal, and she gave those northern KwaZulu different hospitals to Mussolini, by the way. She actually put their lives in danger by whipping up crowds against them, saying they're poisoning our people and so forth. And she eventually suspended 2 doctors, one of whom in a fit of pique, had torn down her picture from the wall and stuffed it in the rubbish bin. And that was you know, taken as the ultimate insult. So, yeah, you know, what I've witnessed shows an unhealthy way of governance, and I think my main objection, if I'm to give a personal opinion, is that doctors who seem to be devoting their lives and giving everything they have and facilitating upliftment of communities way beyond clinical care seem to be victimized. And that's where I kind of think, well, there's something really wrong, you know, that's going on.
And Chris, just a final question with possible solutions and policies coming down the line. We have, of course, the national health insurance on the table. Does that and possible any other changes strike you as the best way to solve these, what I would argue are basic structural and incentive issues, which might be better solved in other ways?
You know, you hear Nicholas Crisp talking, you hear, I remember Motsoaledi talking, say, you know, we can't afford not to have an NHR. Well, while morally I agree, there has to be equal access to healthcare everywhere. I do think it's a blunt instrument. And certainly when I speak to these rural doctors, they say, listen, until you get rural doctoring right, until you get the structure and the support and the admin right, and we feel that we're part of a team going forward and making progress, and that we're not being cut off at the knees when it comes to COVID, that we're not getting oxygen, we're not getting, there's procurement problems. And until we can sort that basic healthcare delivery out, and NHI is never going to fly. That seems to be a consensus that I come across. Morally, absolutely, we have to have equal healthcare. How the NHI seems to be the consensus I'm getting, a blunt instrument.
Thank you very much for watching. We hope you enjoyed the video. Let us know in the comments below your experiences in either urban or rural healthcare facilities. Also, let us know your thoughts on the NHI, and would that really be the best way to solve South Africa's many healthcare issues in both the public and private sectors. Before you leave, a reminder to like this video and also subscribe to our channel if you have not yet done so. And also a reminder that you can access all of our client services. Click on the link below in the description to access our 30-day free trial. Until tomorrow, this is Chris Hattingh for the Center for Risk Analysis. Take care.